Hello, everybody. I hope you guys can hear me. Sorry that I'm a couple of minutes late. I was having some technical difficulties. Clearly, I can't be a professional YouTuber, and I probably need my teenager to help me navigate all this social media kind of stuff. The purpose of today, so my name is Preetha Krishnamoorthy, and I'm a pediatric endocrinologist at the Montreal Children's Hospital. I'm also the medical director at Camp Carawanas, a sleepaway camp for children with type 1 diabetes. And JDRF has invited me here today to talk to everybody about some of the challenges that teenagers are facing, teenagers with type 1 diabetes during this pandemic. So as I'm with you for the next half hour or so please feel free to ask some questions, and I'll try to answer them as we go. But maybe I'll start off with some of the common questions that we've been getting from our patients through our diabetes clinic. So I think one of the biggest question during the pandemic is, are teenagers with type 1 diabetes more susceptible to getting the COVID? So the big answer to that, and I think what we've learned from other countries, what we've learned from around the world in general, is that it doesn't seem to be that children who have well-controlled type 1 diabetes are actually more at risk of getting COVID, so of catching the virus per se. And actually that's anybody with type 1 diabetes. There's no reason to think that they'll catch it more easily than anybody else. And so when actually, I know in Quebec, the government was talking about sending kids back to school, and we had a lot of people asking, should we send our children back to school? Are they more at risk because of the type 1? And the answer, in short, is we do not think they are more at risk for catching it. So in terms of safe hand washing, good hand washing, wearing masks, and the things that the general public are being advised to do, that's what we are recommending for children with type 1 diabetes. Now, the big concern is, if my child with type 1 diabetes does get COVID, are they going to be sicker from the COVID? And from what we know of, there's no evidence to think that kids with type 1 diabetes will get more complications of the COVID per se. But of course, like any virus, when you have type 1 diabetes, it will have an impact on the blood sugars. So you can have highs, you can have lows. You have to remember to check for ketones. And I think having really good illness management skills is important. So what does it mean to manage illness, and what does that mean practically speaking? So it means that you have to remember to be testing frequently, whether it be with a glucometer, with a continuous glucose monitoring system, or a Libre, whatever you use to test, you have to be testing frequently. You have to also be ready to test for ketones, and remember to test for ketones. So a lot of times it happens that I get calls from families and they don't even have ketone strips at home. So have your supplies. Have ketone strips ready and available, and test for ketones. And if your ketones are positive, you need to contact your healthcare professionals to know how to navigate that and manage that. And of course, finally, always have glucagon with you at home as well. Oh, I just got a hello from Nick, one of my patients. Hi, Nick. Nice to know that you're watching. Really, really great to see you there. So of course, managing illness, and I think managing illness, like I said, is being prepared and having your supplies at home. Now, I know that there was a big panic at the beginning as well, where people were saying, well, I better get a few months worth of supplies, and I better have extra. And remember that everybody's in the same boat, and there's no reason to believe we're going to be in any shortage of supplies here in Canada. So if the pharmacy is dispensing a month's worth, take the month's worth. Remember, everybody needs the supplies, and just make sure that when you're running out that you do go to your pharmacy. And don't expect them to give you 3 months worth. Unfortunately, they won't, but there's no reason to worry about us running out. If everybody is getting their supplies appropriately, then we should all be fine. I think a big question, and something we should really be thinking about as well, is not only the physical health of our teenagers, but also the mental health. And I think that's something that we sometimes we put aside because we're so worried about their physical health, but we also have to think about their mental health and how they're doing overall. And I think having teenagers facing this whole pandemic is a really, really big challenge. And I'm not sure if you parents are feeling that out there. I have two children. I have a 15-year-old and I have a 12-year-old. They don't have type 1 diabetes, but I have to tell you, just having a teenager living through this pandemic is definitely a challenge. And I think that we have to remember that, the social health. So we'll get to the mental health aspect of it, but let me answer a few other questions that have come up that I think are really important to address. So summer jobs for our teenage children. Should they be working? So I think there's this fine balance. You know, I've definitely had teenage patients who work in areas that are probably considered a little higher risk. For example, working at a grocery store, and should they be? And my answer to them is, you know, if you're working in a store and it puts you more at risk, how comfortable do you feel? How safe do you feel? Really, you should be using safety precautions like everybody else. And a lot of times I think for some of my teenagers, do they really need the job? And if they do need the job, then it's okay. Just be really safe, clean, gloves, masks, do all the safety precautions. But if they don't really need the job and it makes them feel uncomfortable and it provokes anxiety, then that's something we need to respect as well. But I think that, you know, our children this summer, things are going to be loosening up in terms of, you know, restaurants opening, things opening up, and kids will be looking for summer jobs. And I think it's okay to let our kids with type 1 diabetes find a job and work in the community, as long as they're using the proper precautions, and wherever they work, they're using the proper precautions like anybody else. So I have a question coming in from Anne-Louise. Hi, thank you for listening. So this is a great question about, you know, a teenager doesn't want you to monitor them so closely, but it's kind of hard as a parent when you're all home together. This is a great question, and I think that I think that we have to look at the relationship you have with your child, you know, and it's a really tough one. There's a lot of teenagers who are pushing back and don't want their parents on, you know, over their shoulders. And it's understandable, but I guess it also depends on how they're doing overall. So if they're generally well controlled and doing well, and there haven't been any major concerns at the last visit with their endocrinologist, for example, their A1C is pretty good, they're generally pretty good at monitoring things. I think that even though we're at home, it doesn't mean all of a sudden that we should be totally on top of them, because that could sometimes push them away, you know, and that can create a lot of stress in a family. And I think sometimes when you have a teenager, diabetes in and of itself, even without the diabetes, there's always that conflict. I mean, I'm always yelling at my 15-year-old son to do his homework, and that always causes conflict. And sometimes I realize that I just need to take a step back and allow him to do it. So I think if they're not in any imminent danger and overall their control is good and they're taking good care of themselves, we have to trust. And just because we're around, it doesn't mean that the routine we had has to change necessarily. So I hope that answers your question. So I guess, but at the same time, if your healthcare professional says, look, I'm worried about your child, I want you to keep an eye on them, then that gives you a full right. You know, sometimes I set the ground rules in my clinic with my teenage patients. Sometimes I tell the parents, look, your child is doing great. Your teen, I shouldn't say your child, your teenager, he or she is doing great. And you don't need to watch over them. And I actually set that ground rule in the office. Or I may say, look, they're not doing well, and I'm giving the parent permission, and I tell the teenager in the room. So I set the ground rules based on how they're doing. So, but just remember, just because we're all of a sudden home doesn't mean we should be micromanaging. And I think that if we do, that'll drive us all crazy. You know, I know, like I said, and I use the example of school, which is very different from diabetes, but I'm on top of my son because I'm right here and I see what he's doing, and I realize that that's just driving us both crazy, and it doesn't call for necessarily a healthy household. So somebody else, Jamie, is asking about the multi-system inflammatory syndrome and how it affects type 1. So from what I understand, I'm assuming you mean this Kawasaki-like syndrome that we're seeing a little bit more. Kawasaki syndrome is a rhematologic condition that is actually a clinical diagnosis based on many symptoms. And the classic diagnosis is made by a patient having 5 days of fever plus 4 out of 5 other symptoms. And those symptoms include redness of the eyes, the oral mucosa can be affected, so the mouth gets all red and dry and chapped, a lymph node, then their hands can get swollen, and they can have a rash. So they need multiple symptoms to make this diagnosis, and we know that there could be other inflammation going on when this happens. So we're seeing a lot more Kawasaki's, and it's thought to be triggered by a viral illness. So Kawasaki has existed for a long time, and we do see it regularly at the hospital, and I think we're just maybe seeing it a little more now and linked to this particular virus. So to our knowledge, is there an increased risk of Kawasaki in kids with diabetes? Not to our knowledge and to our experience thus far. But of course, like any other child, children are more at risk for Kawasaki. It's a childhood condition that we do see. So any viral illness could potentially trigger it. But in terms of the patients we're seeing, we're not seeing more children with type 1 diabetes and Kawasaki than anybody else. So there's no reason to believe that we're going to see it more in kids with diabetes. But like any child with Kawasaki, if you have those symptoms, you need to seek professional help immediately. It is a condition that requires treatment, and the treatment requires hospitalization and special medication, and it needs to be done in a fast manner. So if your child does have those symptoms. That being said, I will say Kawasaki is generally a disease we see in younger kids and not as much in teenagers. So I think that's important to be aware of. Let's talk a little bit more. Let me see, where were we at? We were talking about summer jobs. We were talking about illness management, school, going back to school. So another thing, I think it's how about what's going on at home and routine at home now that our teenagers are at home. Is there anything we could be doing to promote being healthy during this time? So I think that it's what we're seeing a lot of, and I think that if you're looking on social media and everything, there's lots of stuff going around about how all of us are maybe gaining weight because we're eating all the time. There's a lot more alcohol consumption among adults. The SAQ sales are going up. So a lot of things are changing because everybody is home. So how can we make our household healthier? So the first thing I do think is really, really important is still keeping like a healthy attitude around eating and still healthy choices available. So it's really, really hard, and I could tell you, like, even though I'm working in the clinic in the hospital, I'm still doing some work from home as well. And it's really hard to juggle everything and juggle our children's school and make sure I have good, healthy stuff in the pantry and ready for the kids. But I do think that's something super, super important. So stock your fridge with good, healthy foods, healthy snacks. So even if they want to eat, that they have good choices and that they're not just grabbing whatever is there. And I think this is for kids with diabetes and kids without diabetes, really for everybody. These are kind of little tips that I think are important. And it's certainly easier said than done. And I know it's hard because even just going to the grocery store is a huge endeavor. Right now, there's definitely some grocery food delivery services that you can find that deliver fruits and vegetables, lots of healthy options. So I do think keeping our home stocked with good stuff is going to be great because our kids are home more. They are going to come into the kitchen and grab stuff out of the pantry, and so keeping healthy stuff around is good. I think we also have to recognize, and this is again something that's not exclusive to anybody with diabetes, but really true of anybody, is that when we're bored, we eat. So if our children are around and they're eating and they keep going to the pantry, maybe it's because they're bored and they're not really doing anything else, So try and get them outside. Finally, the weather is nice. Get them outside. Get them doing activities. Have some kind of goals or things that they like. So for example, If they are doing school, they have online school, so they have to be online. If they are not in classes and they're a part of a sport, even though they may not be having their formal sports team practices, see if you can encourage them to keep up their skills by going outside. So my kids, for example, play soccer, so they have to go outside and touch the ball every day, and that's part of what they need to do. And we're lucky to have the support of our coaches to tell us that too. But if they are a part of a team and nothing's happening with that sports team, maybe reach out to the coach and see if the coach can give them activities that they can do that a little more structured, that keep them occupied. Another big question is, how much should we allow them to see other kids and other people? And I think this is a really, really tricky one that I'm facing as well. So I think that now that we're allowed to have people in our backyards and up to 10 people and maintain a social distance, I do think that with the nice weather that kids can start interacting. And here is where it comes into play that mental health is such an important thing. So if your child is craving that social contact, I think we should be trying to encourage it in a safe way. I find a way that I can control it is having the kids at my house, so I know what's happening and it's in my backyard. I see what's happening and I can control it. I know it's not always so easy, but I'm trying to encourage, if my son is socializing with kids, that it's with a child I know that I can trust, the family, that they're also following the same rules that I'm following in terms of social distancing and good practice and staying clean and things like that. But I do think we should be allowing them to get that social, connection. I think we all need it. We all crave it. And I think if they're not getting it, that could lead to depression, anxiety, and all of those things. I also think we have to kind of keep our eyes open to those things. How are they feeling? How are they acting? How are they reacting? Are they in their rooms and not talking to anybody and withdrawn? Recognize if there's a problem. There are tons of resources that we don't really think about. So for example, our social workers, all of the hospitals have social workers involved in our diabetes teams. So if you're struggling or you're worried, reach out to the social worker on your diabetes team. Even though you may not be able to see them, they can do a Zoom visit or a phone visit. And remember, sometimes if your teen is struggling and you're worried about them from an emotional point of view, sometimes they refuse. Maybe they don't want to see anybody. Maybe they don't want to talk to anybody. But remember that the resources that are there are for you as well. So you can talk to the social worker and get the tools you may need to help you navigate the situation with your teenager. You can meet with a psychologist and set up, an appointment. So it doesn't always have to be them. And I'll tell you that, I find sometimes for me, being the parent of a teen, talking to someone objective can really, really be helpful. I don't know if this is something that everybody else is experiencing, but I can tell you that I find it's a little bit hard, because when you're a parent and you're surrounded by other parents and everybody's talking, everybody's doing a different thing. And there's a lot of judgment in the sense that, oh, well, I'm not letting my child do that. I can't believe you're letting your child do that. And I can't believe that, she had 3 kids in her backyard, or that person let their child go biking. And as a parent, it's sometimes really hard to hear that, those judgmental kind of voices around us. I'll give you another example of, video games. I'm sure that many of you have kids who might be video gaming late at night and going to bed at 3 in the morning instead of 10 o'clock. And I think you have to remember that this is new for everybody. There is not necessarily right or wrong answers. So I think we also have to remember that and be kind to ourselves, and remember that, just because another parent may not be making the same choices as us, it doesn't mean one is right or one is wrong. We just have to do also what we're comfortable with. And I also think that we have to pick and choose our battles. And I was speaking to a friend and a colleague earlier today, and she made this beautiful statement, which I thought was really cool. Her statement was, "I choose peace." And I thought that was really very, very wise statement, because I was arguing with my son for a long, long time when he was up video gaming late at night. And then I thought about it a while and I said, you know, what's the big deal? He doesn't have to wake up in the morning. And this was when the weather wasn't so good. And he was actually socializing during those few hours at night. And that's not necessarily an unhealthy thing, you know? So it's good to socialize. And that's the way he was doing it. And when I stopped stressing about it, I just felt all of a sudden it was this load that was off my shoulders, but also the house felt calmer and more peaceful because we weren't arguing the same fight all the time. So I guess you have to pick your battles, you know? We have to pick our battles and remember that this is new to everybody, new to us, new to them. So, you know, what's really important, what's really not so important, we need to decide, and what's important to you may be different for somebody else. So remember that. I think that's such an important key. And I guess picking our battles is a big thing in parenthood in general. Let's see, does anybody have any other questions? Let me see what other things that we've been asked. Transition to adult care. This is not an easy time, you know, and if you have to transition right now during this period, because as you know, a lot of visits are being done by phone. So it may so happen that your first visit with the adult doctor is by phone. And it's a little bit strange because you're not actually meeting them. Some of the adult clinics are seeing patients in person. We're all ramping up in the next few weeks and we'll be seeing more patients. But I think the key is, if a transfer has been done, if you're offered an appointment in the adult world, be it by phone or in person, take it. Don't cancel the appointment, go to the appointment so you have your spot in the system and that you make that connection with the adult doctor. I think that's really important. Now, on the other hand, it's also important for you to know that if that appointment doesn't happen because of the pandemic and things are put off, that's okay. Your pediatric physician is responsible to help you up until the day you're transferred. So even if you're 18 and a half, but you still haven't seen that adult doctor, you can always actually go back to your pediatric team and ask for help, and we are responsible for following you until that transfer is done. Okay, so that's really, really important. And with things happening now, this could be a real issue, you know. When kids transfer to the adult world, it is very different. There's probably not as many reminders and callbacks to do things and we're much more, I guess we're much more coddling in the pediatric world, like parents. So that is going to be a change that's going to happen, and it's, like I said, it is always going to be a little more difficult if that first connection with the adult center is on the phone. But just make sure that if it is a visit by phone, that you know when an in-person follow-up should take place. And I would say support your teen in that. Like, I think that teenagers, you know, it's not like you magically turn 18 and then you remember to make appointments and follow through on them. So I think as parents, be on top of that. Make sure that an appointment is made. If they haven't seen the doctor in person, you make sure that you follow up on that with them and support them in that process. Just to let you guys know, I know at the Montreal Children's Hospital, we're postponing transfers. So usually kids who turn 18, we can no longer care for them unless we ask for an extension of care. Well, for us, our DPS of the hospital has automatically said we can postpone transfers for a few months, just so that we get to see our patients and make sure things are done well and that things don't slip through the cracks during this pandemic. We have a couple of minutes left, so if you have any questions, I'm happy to take them. There was one other question that came in ahead of time about what do I do about my child who is concerned about their weight and is limiting carbs or potentially omitting insulin. So this is a really big red flag. And I think that we have to remember that for teenagers, body image is such a big thing. And for any teenager, you know, we may see them using unhealthy methods to lose weight. So it may be by restricting what they're eating, or impulsive exercising, or laxative abuse, and there's a lot of things that would put a child in the category of having disordered behaviors related to weight. Well, type 1 diabetes, unfortunately, is a condition that there's a big focus on carb counting and food, and patients are weighed at every visit. But unfortunately, type 1 diabetes gives them a tool, which is insulin, that can put them more at risk of omitting insulin to lose weight. So this is a real problem. So when you see that this is a problem and you're concerned, this takes more than just your diabetes care team. And often patients who struggle with this, if it's to the point where we're really concerned about their safety and how they're doing things, we may consider involving adolescent medicine and having an interdisciplinary approach to caring for patients. Now, I may have some patients who just want healthy habits, and that's different, So it's okay to support healthy habits. I think it's when it becomes obsessive, and that's when we have to worry about things. So don't be afraid to bring this up. And if this is a concern you have about your teen, please bring it up and let us know. It's a real issue. It's a really, really big concern that we can help you with and help navigate, and bring in the proper consultants if necessary. Any last questions? Because we have just a few more minutes. I will tell you that we're getting a lot of requests for pump starts now, because people are saying, well, we're home. Can we start my child on a pump right now? Because the timing is perfect. We're home, they're home. Can we do it? Yes, we appreciate that the timing may be perfect. But just remember that your healthcare team is juggling many things, and when we do pump starts, we like to do them well. We want to make sure you've gone through the process of learning how to count carbs, gone through the process with the nutritionist, and we usually do a lot of pre-pump teaching, and we want to do this properly. So we don't want to just rush through because of the pandemic, and just keep in mind and be patient with us too, that we have a long lineup of patients who are waiting for pump starts too, and we try and do it as much as possible. We don't want to put things on hold because of the pandemic, but for sure things aren't working quite as smoothly as normal, but it is something that I think we need to work on in terms of trying to do more teaching through Zoom and through Teams and through all these different platforms. So give us a chance. Hopefully we're getting there. And we'll be able to do more of the teaching in this manner to get our patients to have the best care and the teaching that they need. Does anybody have any final questions? It's 7:30, and if anybody has any final questions, I'm really happy to take them. If not, I just wanted to say thank you for being here, and thank you for listening, and JDRF, thank you for inviting me, and hopefully I will get to meet you all or see you all one day soon. Have a great evening, and thanks for joining in.